Hello and welcome to this special feature. Now, nothing is more precious than life, and the sign of being alive is the continued pumping of our hearts. When the heart stops beating, that's when you can get into a cardiac emergency. As per the World Health Organization's census statistics, mortality due to cardiac causes has overtaken mortality caused by all cancers put together. Worryingly, the onset of heart disease is now seen at a younger age, especially in people who are in their 30s and 40s. The biggest reason for heart-related deaths is a lack of awareness as to what needs to be done in a cardiac emergency. Now, every adult should know which conditions qualify as heart-related or medical emergencies. And the best way to do this is to learn beforehand the actions required in the case of a cardiac emergency. Life-saving techniques like CPR can give you the power to save a life, and it's been proven that bystander CPR improves the rate of survival by almost 50%. It's perhaps even more important if you have a loved one with a history of cardiac disease, as research reports that the majority of cardiac arrests happen at home. Save a Life is an initiative through which people are being made aware of the early signs and symptoms of cardiac arrest and also what to do. Today we have with us eminent cardiologists who can help you understand sudden cardiac death as well as the role of CPR to revive and save a life. Joining us, Dr. Naveen Kumar Cheruku, Senior Consultant, Interventional Cardiologist, Sunshine Heart Institute, Paradise, Hyderabad. We're also being joined by Dr. Pradeep Warkhane, Consultant Cardiologist with Dr. Kuber Sri Sai Divine Cure Multi-Speciality Hospital, Chandrapur, and Dr. Sameer Saraf, Head of the Department of Cardiology at the UPUMS, CEFI, Etawah. Let me begin with Dr. Cheruku. What are good and bad cholesterol, and how do levels of good and bad cholesterol actually affect the heart? Can high cholesterol in the blood actually cause heart-related emergencies? Dr. Naveen Cheruku?
Actually, the cholesterol is a very important parameter to monitor in our day-to-day practice of life, because this is an important risk factor for heart disease. So when you see the cholesterol, so we have the total cholesterol, which have divided into subdivisions of cholesterol levels. And among the cholesterol levels, you consider few of the cholesterol which is considered to be bad and few of them considered to be good. Among the bad cholesterol, the subcategories of cholesterol levels are LDL and VLDL and triglycerides. These are the three considered to be bad cholesterols, whereas HDL, which is considered to be a good cholesterol. And when you see them, the level of cholesterol at which this is causing the heart disease or harmful to the body. And when you see the LDL levels, anything less than more than 100 is considered to be a risk factor, and VLDL anything more than 30, and triglyceride anything more than 150 considered to be abnormal. Whereas good cholesterol, which is considered to be the HDL, should be more than 60. So these are the levels at which you need to target for individual to not to succumb to any this heart disease.
If I can bring in Dr. Pradeep Warkhane now. Dr. Warkhane, what should be the ideal weight or the body mass index for good heart health? What is also the ideal waist to hip ratio? These are terms that we keep hearing about. There's also abdominal fat and the risks associated with that. So if you could tell us a little more about all these three things.
Okay. So ideal BMI for the as a World Health Organization said, it should be 18.5 to 24.9. But for Asian population, it should be 18.5 to 22.9. So it is a ratio which measures your height and weight. And then regarding the waist hip ratio, it should be less than 0.90 for males and less than 0.80 for females. And regarding the abdominal fat, it is one of the most predisposing risk factor for the insulin resistance, dyslipidemia, heart diseases, and all other risk factors which can ultimately lead to the heart diseases. So yes, the abdominal fat, the belly fat, we can say, is one of the most important risk factor.
Right. And is there an ideal waist to hip ratio also that we should be looking at, Dr. Warkhane?
Yes, it should be less than 0.90 in males
Yes.
and in less than 0.18 females. It should be,
right.
And as it is increases, risk increases.
Dr. Saraf, if I can bring you in, what are the signs that one has a heart problem? When is it that, we should know it's time to see a doctor? Also, sometimes there's breathlessness caused by heart problems, sometimes by lung problems. How do we distinguish between the two?
Yes, first of all, thank you for having me on board. Most common warning signs and signals of heart patient are a little bit different in men and women. Like we can say precordial chest pain, palpitation, shortness of breath, syncope, and cold sweats. So whenever we are discussing about women, they are having more uncommon symptoms present in them, like indigestion, nausea, vomiting, arm pain, jaw pain, neck pain. And when talk about shortness of breath, it's a clinical examination and history is very important. The shortness of breath due to respiratory disease have a certain specific history like exposure to allergens, exposure to smoke. They are chronic smokers. They are having this history for long. The saturation exaggerated due to seasonal variations. And when we consider heart disease, then the dyspnea may be only on breathlessness. They should have given history of paroxysmal nocturnal dyspnea, orthopnea, or chest pain accompanying. So these are some examples that we can differentiate between breathlessness due to respiratory disease or cardiac disease.
Right. Dr. Cherukoo, as most people still don't know the difference between a heart attack and a sudden cardiac arrest, many people may mistake recognizing the symptoms. So if you could tell us a little more about how we can make out when it's a primary cardiac arrest. Dr. Cherukoo?
Yeah, when it comes to the difference between a cardiac arrest and between the heart attack, see, the heart attack is nothing but the decrease in blood supply to the heart. The blood vessel which is supplying to the heart, we call it as coronary arteries. So when there is a block in the coronary arteries, suddenly we call it as acute heart attack. But when it comes to the cardiac arrest, when there is a decrease in blood supply to the heart stops beating. And it cannot eject the blood into the circulation, so we may not get blood to any part of the important organs of the body, like brain, kidney, and important organs, primary organs of the body. So then he become unconscious, he become loss of consciousness, and these we can call it as cardiac arrest. So cardiac arrest, then you need to intervene emergency very promptly, and you beg them do CPR, that is cardiopulmonary resuscitation, to make the heart to pump to the different organs of the body, then only the person will alive. And when you come to the heart attack, the decrease in blood supply, this subsequently leads to the pump failure, that will again leads to the cardiac arrest. So the heart attack is in particular to the only decrease in blood supply, whereas cardiac arrest is complete cessation of the activity of the heart. So these are the differences. So how can you recognize both of them? In a heart attack, patients have the chest pain, they have the breathlessness, they have the sudden sweatings on the body. These are some of the presentations. Whereas cardiac arrest, they suddenly lose the loss of consciousness. They suddenly they become flat and wherever they are. So that is the way they have the cardiac arrest. So it is very important to recognize both these conditions because both are emergencies, and both needs to be tackled as early as possible.
Right. Dr. Pradeep Arghane, what is the first thing that someone should do if someone around you goes into sudden cardiac arrest? Is there a sort of procedure that has to be followed? What would you recommend?
Yeah. So whenever someone goes into cardiac arrest, first thing is that you should verify that it is scene is safe, means the location is safe. You should not do the CPR in the middle of the highway or middle of the fire. So you should first secure that the scene is safe, and then you should start with the chest compression. You should ask for help as early as possible. You should ask for the medical attention or the ambulance or medical help, and start with the chest compression. And more the people, more the successful outcome of the CPR. So more and more people and more help you should ask for.
Right. Dr. Saraf, let's actually go into this in greater detail, because lack of CPR awareness is a big health challenge in India. If you could maybe break this down for us and tell our viewers exactly what the main steps are of CPR, Dr. Saraf.
First of all, I want to understand the importance of the CPR. As I want to tell, with every second, 60-second lost, chances of survival drops by 10%. With every 4-minute loss, chances of brain damage happen, and every 10-minute loss, chances of survival are very, very minimal. So we have to understand, and the CPR status should be included in curriculum of school, college, and university. Every layman person should know the CPR. So coming to the CPR, as it includes, it's called cardiopulmonary resuscitation. Rather, I would say it would have been called cardiopulmonary revival. It should comprise of CAV, C for compression, A for airway protection, or V for rescue breath. Like Dr. Pradeep said, we should immediately start chest compression. That should be rate and depth should be specified. We should do around 100 to 120 per minute, and depth should be not more than 2 inches. Not more than 2 inches, it should be around 2 inches. And there will be minimum interruption between chest compressions. After every 30 chest compression, 2 rescue breaths should be given, and we should check for the breathing and pulse rate, and we should do it repeatedly until help or automated external defibrillator arises, and we should repeat this cycle again and again.
All right. Dr. Saraf, that's a very comprehensive answer. Thanks very much indeed for that. We will take a quick break at this point, but when we come back, we'll talk about when not to give CPR, what to do when, whether at all it can damage someone when you're trying to give CPR, and much, much more. We'll be back in just a moment. Welcome back. We're talking about heart health and the importance of life-saving techniques like CPR. Let's go right back to our experts on the show. Dr. Cherukoo, can you actually damage someone's heart if you perform CPR while it's beating?
No, actually, when you are doing CPR, it doesn't harm to the patient. Basically, it is basically for revival of the patient. And when you do we never do CPR when there is a heart is beating. That is the time where you stop the CPR. And when we are doing the CPR, we have the giving the chest compression. That should be a good compression that needs to give the cardiac output from the heart. So that is called effective CPR. And in that doing the CPR, there is a little chance that the fracture of the ribs can happen, but it never harm to the heart. There is a chance to the ribs may fracture, very rarely, but it doesn't harm to the patient. CPR.
Right. Dr. Warkani, let me bring you into this also. What if the person actually has an ICD or a pacemaker and then they have a cardiac arrest? Can one actually perform CPR on someone who already has a pacemaker?
Yes. CPR is the life-saving technique. Whether the person has pacemaker, ICD or any other device, you should perform the CPR as soon as you are available for the CPR. And in hospital settings, the CPR may differ for the ICD and pacemaker patient, but for a layman, it should be basic technique as we are discussing. You should perform CPR as early as possible.
Right. Dr. Saraf, what exactly are the current guidelines for CPR in India?
Actually, Indian doctors fellows are also following AHA guidelines that include CAV, but with few restrictions, because Indians population in Indian countries have financial limitations, not easily available resources like AED, automatic external defibrillator, and trained paramedic. So Indian Resuscitation Council (IRC) have drafted a new change form of CPR that includes COLS, means compression only life support. That can a layman person can also do chest compression without proper training outside the hospital. Then the role of BCLS come, that is advanced basic life support circular system. And then the role of CCLS, comprehensive cardiovascular respiration system. So with these minor changes, the roughly CPR guidelines are the same, but we are a little bit more lenient towards CPR. We encourages every layman person should be able to do CPR, especially chest compression. They are the most important part of the CPR.
Right. Dr. Vargani, how important is it to manage hypertension or reduce the risk of heart disease? What advice would you give for the better management of hypertension?
So hypertension is the one of the most prime risk factor for all the heart diseases, we can say. Right. It can lead to the diabetes, heart attack, or any other disease. So first is the lifestyle change. We are seeing that we are living in such an era that all the things are available at our tips. But lifestyle change, you should control your weight, you should have a daily good routine, you should have a sufficient sleep, and most important, stress free life. You should try to minimize the stress as early as possible, because it will lead to all the other conditions. Mostly the young heart attacks are increasing because of the stress and the addictions. One of the most two important risk factors, we can say, is the stress and addictions in young heart attack. So hypertension control and the follow-up with the doctor is most important. You should control your risk factors and you should have a regular follow-up with your doctor.
Dr. Saraf, anything you would want to add to these points on how exactly you can reduce your stress factors?
Actually, I want to say that in today's world, everybody is trying to do multitasking at a moment. Means a person is also doing a job in hospital, doing some job outside and involved in some commercial activities. So a person should not be so on the toes. A person should relax, a person should sleep at least 6 to 8 hours per day. A person should spend time with his family, with his friends, and a person should not be over ambitious. Along with that, a person should seek psychological help also if he or his friends or his family members are facing any kind of problem. For stress and addiction, as Dr. Pradeep told, are the most important cause of young heart attack that is happening quite prevalent in the present times in India.
Right. Dr. Cherukoo is back with us. Dr. Cherukoo, is, we see in movies, TV shows, people believe that the only symptom of a heart attack is severe chest pain. Now, is that necessarily true, or are there other symptoms as well? Dr. Cherukoo?
Yeah, the primary symptom is the severe chest pain with the sweating. That's the most common presentation of a heart attack. But in addition to that, there are other presentations, like they can have the breathlessness while walking, even small exertion, they get the breathlessness. That is again is the equivalent to an heart attack pain. We call that angina equivalent. There is another visit on palpitation. Some people they present with the heart palpitations. This again is we can call it as angina equivalent. But any pain which is considered to be from jaw to in the chest, we can consider, unless proved otherwise, we consider to be it's a cause of heart attack. So some people they just present with a jaw pain, some people they present with epigastric pain, and some people they can have the presentation with sweatings while they have having the lunch or dinner. That's called postprandial angina. So, and some people they just extremely weakness. They can have the if you evaluate them, they can have the heart attack. So these are some of the symptoms. In addition to chest pain, they can consider to be equivalent to angina equivalent to a heart attack. So these people needs to be evaluated as early as possible, and they can go to the nearest hospital and they can get evaluated with ECG and echo where the patient is available.
Right. Dr. Saraf, does heart disease actually affect women differently from men?
Yes, that's a quite important question. Heart disease affects a little bit different from women, and it's a misconception that women are preserved because of their hormonal thing. It's true. Women are affected 7 to 8 years later than the men average. But seeing the blood vessels, smaller blood vessels, the heart diseases in women are a little bit diffuse and discrete. And the symptoms are also quite different. Means the uncommon symptoms like indigestion, nausea, shoulder pain, cold sweats, extreme fatigueness, extreme distressedness, and unable to rest. These are quite different symptoms that are found in women. So we should take them very seriously. It's not like that they will present always with chest pain or shortness of breath. Because the men and women are different.
Okay. Dr. Cherukoo, people who survive one heart attack could be at the risk of another. So what precautions would you say specifically for those people to reduce the chances of a second heart attack from happening?
See, when patient have heart attack and revive, so they need to have to change their lifestyle first. So they have to their lifestyle. For example, those who are obese, they need to be reduction of weight, and those who are say sedentary lifestyle, like they can constantly sitting and they doesn't have any walking habit, they should have some sort of walking or exercise is very important. And those patients who have already had a heart disease and the confidence with the medication is extremely important in addition to the change of lifestyle. So whatever medication prescribed by the doctor, you need to be controlled. And the lipid levels, that is the cholesterol levels, you need to target the achieved levels for a particular patient. For example, if the patient had only heart attack, they need to level maintain below 70, and if they have recurrent heart attack, they need cholesterol levels, especially the LDL levels, they should maintain below 50. So you need to target these cholesterol levels, and they should maintain the lifestyle modification, and they should have proper compliance with the medication. Is very extremely important to prevent from further attack.
Right. Thank you very much indeed, doctors, for all your advice and expert comments today. As we said at the start of the program, everyone should know which conditions actually qualify as heart-related or medical emergencies, and we hope this discussion has helped you do exactly that and give you a better sense of life-saving techniques like CPR. Thank you for watching. Save a life.